The Way to Wellness, brought to you by OnePeak Medical.
Today on The Way to Wellness, we're joined by Shannon Galpin, a family nurse practitioner at OnePeak Medical. Shannon is here to help us understand what your body's trying to tell you and share simple, practical steps that you can take to start feeling better. Today, we're diving into navigating all the health information that's out there and focus on what truly matters for your well-being. Shannon, hello.
Hello, thanks for having me.
Of course. So I'm sure that many of our viewers are overwhelmed or confused by all the information out there about staying healthy. So what are some ways that you help your patients navigate all of this?
So we really try and meet patients where they're at and find out what their concerns and issues are, and then develop a very comprehensive plan to help them with their overall health and wellness.
Yeah, and what do you wish more people knew about their connection between their symptoms and their overall health?
Well, I think one of the things that's important is to look at what their symptoms are and to look at those labs that correlate with those symptoms, and then try to create a plan that's very individualized for patients.
Absolutely. And can you talk about how normal levels on a lab test don't always mean optimal health for your patients?
Yeah, so we know oftentimes we'll have patients come to us that say, I did have my thyroid checked, for example, and my labs look normal. But yet when we look at those labs, they're not in optimal ranges. So we really try and get people in those optimal ranges to help with their overall health and wellness.
Yeah, so what is one small change that someone can make today that's a powerful step toward better hormone balance and weight management?
So I think it's important to know, like, are you insulin resistant? Do you have diabetes? Do you have something else, maybe a thyroid issue that may be causing you to have weight gain, feel a certain way? And so we like patients just to meet with their primary care provider, look at their labs, just kind of figure out a plan to comprehensively treat them.
Yeah, at the end of the day, it could be what they don't know.
Right, absolutely.
Well, Shannon, thank you so much for joining us.
Thanks for having me.